Well, a controversial news conference held by two California doctors has gotten a lot of attention on social media this past week, but not good attention. Q2's Shaquille Cozart has more from a Billings doctor who dismantles their claims and tells the community to continue to social distance.
Videos of a news conference held by two California doctors has gone viral in the past week and has been repeatedly taken down from YouTube due to information that causes health concerns.
Do we need to still shelter in place? Our answer is emphatically no. Do we need businesses to be shut down? Emphatically no.
During the conference, both doctors went against CDC guidelines and denied the importance of national and local government stay-at-home orders. We talked to Dr. Brad Fuller here in Billings for his thoughts on the claims that were made by those doctors.
First of all, just to say we should get it and build up a natural immunity isn't appropriate because we still don't know long-term sequelae from this infection. We don't know if it increases your risk of lymphoma. We don't know if it increases your risk of chronic lung disease. We don't know if it increases your risk of heart disease. We don't know enough about it now to say, oh, if you get it, no big deal.
Dr. Fuller states that there are flaws in the arguments regarding our body's immune system.
We've already been exposed to many viruses, bacteria, fungus, and our immunity is built up. So to say that if we quarantine ourselves in our house for a month or two, that we lose this immunity, that's simply not true. Our immunity lasts for years, decades, centuries, potentially.
The two California doctors also attempted to compare COVID-19 to influenza, stating that the spread of COVID-19 has been similar to that of the flu.
They talk about it's ubiquitous and that it's out there. Influenza is out there, coronavirus is out there, and that people die from flu and people die from coronavirus. It's the same. It's not the same at all. More people died in 1 month from coronavirus than we did the whole flu season.
One of the main claims that was made during the conference was that COVID-19 has a very low mortality rate at around 0.01%, which they say is less than the flu.
If you did the same logic that they are using, I calculated the number for global, let's just go global now. The mortality rate would be 0.0029%. According to their math and their fuzzy logic, that's no big deal then. If we're worried about 7.8 billion people in this world and only 0.0029% are dying, large volume, small death, that's just such an illogical number.
Dr. Fuller urges the public to continue to social distance and follow the guidelines that the CDC and Yellowstone Unified Health Command have put in place to keep people safe.
Social distancing works. If you take the percentage of deaths by the percentage of population, it is clear as day how it works.
In Billings, Shaquille Cozart, MTN News.
All right, great information. Thanks so much, Shaq.